Could you have diabetes and not even know it? Hi. Welcome to the channel and thank you for stopping by. In this video, I want to discuss the question, could you have diabetes and not even know it? Did you know that almost 1/3 of all the people with diabetes don't know they have it? The symptoms seem so harmless, like just getting older. This video will go into different types of diabetes and some of the common symptoms of each to help you understand diabetes a little better. We're going to cover 3 main types of diabetes. They are Type 1 diabetes, Type 2 diabetes, and gestational diabetes. We'll start with Type 1 diabetes. This type of diabetes has also been called insulin-dependent immune-mediated diabetes. It occurs when your body can't produce insulin as a result of the immune system attacking the insulin-producing cells in the pancreas. This type of diabetes is usually diagnosed in children and young adults. It was previously known as juvenile diabetes. Type 1 diabetes increases the risk of other serious complications, like heart disease, nerve damage, blindness, and kidney damage. Some of the symptoms include increased thirst, increased urination, weight loss, even with increased appetite, nausea, vomiting, abdominal pain, fatigue and absence of menstruation. Next is Type 2 diabetes. Type 2 diabetes is the most common type that fails to be diagnosed. It progresses slowly and causes other symptoms such as skin infections, poor healing, kidney problems, and vision problems. It is common that these complications, nor diabetes is diagnosed after years of mild symptoms. The problem is usually that people have no severe symptoms, and so they don't seek medical care at all. They just think of the symptoms as simply part of getting older. This is one of the reasons that it's really important to get regularly tested for diabetes in the most common age group, which is over 40. Less commonly, a doctor may treat other diseases without realizing to test for diabetes. Let's get to the final category, which is gestational diabetes. Gestational diabetes occurs during a woman's pregnancy. Pregnant women who have never had diabetes before, but have had high blood sugar levels during pregnancy are said to have it. It affects 4% of all women during pregnancy and the symptoms include increased thirst, increased urination, weight loss in spite of increased appetite, fatigue, nausea and vomiting, frequent vaginal bladder and skin infections, and blurred vision. Gestational diabetes can be missed in pregnancy. It usually starts with mild symptoms that can often be attributed to other things. It's important to get tested during pregnancy because having high blood sugar from gestational diabetes can do harm to the baby and sometimes lead to other complications. Even if you're not pregnant, you should make it a priority to get tested. Many women have gestational diabetes and think about their symptoms as just being those that are common to pregnancy. You never know, maybe it is, but it's always a good idea to get tested. If you're having any of the symptoms of diabetes, it's important to see your doctor. Even if you think it's absolutely nothing. It's better to be safe than to be sorry. Thanks for watching. If you found this video helpful, please give it a like, or share it with someone who would benefit from this information. Worried that you might be developing diabetes, or want to know more about its signs and symptoms? Then click on this next video to learn about 8 signs of diabetes symptoms.